Hey everyone, it's Megan. I just wanted to make a quick update. Hopefully this time it'll upload to YouTube because the past like 3 videos I've tried to make, they won't upload to YouTube for some reason. I don't know. But I just wanted to do kind of like an update video to let you guys know what's been going on with my health because I haven't been able to like put one up recently or anything since like I had my gallbladder taken out. I think that was the last one. That was back in March or something, and it's September. So yeah, a lot of stuff has happened. My stimulator for my gastroparesis is still working good, my gastric stimulator, and my settings have been increased a lot more since the last time I made a video. Right now they're at 6.5 for my volts, and I'm on for 2 seconds and off for 3. And then my hertz is increased too, but I can't remember what it is because I don't get a printout from my GI doctor like with all my settings and stuff, how I used to get with the Medtronic rep. So I just remember what was adjusted, but I can't remember exactly what the hertz was. But it's still working pretty good. I've been getting sick like maybe once a day now, which is a little more than like 1 or 2 times a week like I was doing, but it's still a lot better than 12 times a day like how I was before I got my pacer. So I'm still thankful that like it's working for me and stuff. I was maintaining my weight for a while, like a few months or so, but just recently I've been losing weight again. Like I lost another 5 pounds. So like I think I'm at like 110 right now, which is really good because I don't even remember the last time I was at 110, probably before I got sick. But I've lost like 5 pounds, so yeah, that's not good, but that's okay. I'm still eating like a little bit more of a variety with my food. I'm just kind of being cautious because I don't like want to get sick, so I'm trying to like still have like a good like diet plan and stuff. Not diet plan, but like a food meal plan, because I can't still like go out and eat like popcorn or something. I never do good with that. But yeah, I think that's about it for my gastroparesis. I was hospitalized again like a few months ago for dehydration and stuff, and I got my stimulator adjusted and all that good stuff. Oh, and when I go up to 8 for my volts, I have to call in the Medtronic rep again because my GI doctor, he's never adjusted them higher than 8, which is okay because that's kind of like up there with the settings. I think the highest one you can do for the volts is like 14 or something like that. So like I'd still have a ways, but just to be safe and like figure out what's the right settings for me and everything. But I still have a little bit of a ways to go, so I'm not too worried about it yet. I've been averaging like a few months and then I need an adjustment. So I can go a couple months without getting an adjustment and still feel okay and like keep my weight and like get proper nutrition and stuff. So I think that's it about my gastroparesis, but I've went to a few rheumatologists for my joint pain that I'm having. It's gotten really bad in the past couple months. I have like all over joint pain and I'm constantly in pain, and like I have like my heat pack thing, because I can't use like the electric ones near my stimulator and stuff. I don't know, but the rice one is good because it has like, it keeps the moisture in and stuff, and I think we got this at like Walgreens or something. But I use that like every night to sleep, and then like I take Flexeril, which is a muscle relaxer, but it helps me sleep also. Otherwise I'd be tossing and turning the whole night from being in pain so much. And then right now I'm on Cymbalta for pain, but I don't really like being on Cymbalta because, I don't know, it can like affect your mood and stuff, and I don't want anything like to happen or anything. But I'm trying to like get off of that if it's possible. The rheumatologist that I was seeing diagnosed me with myofascial pain syndrome, but when I talked to my GI doctor about that, he's like, well, I think you might need to get a second opinion, and so he referred me to a pain management doctor. So I've been seeing a pain management doctor for like the past month, and he doesn't think I have myofascial pain syndrome. He said that's just kind of like what they say for generalized pain, and he thinks my pain is more of like an arthritic pain than that. So he doesn't want to treat me with medicines because it'll just slow down my stomach more and it'll like counteract what my pacer's doing. We don't want that to happen because right now I'm maintaining my GP. So that's really good. But he has been treating me through procedures. So I had 2 nerve block injections done. One on my sacroiliac joints in my spine and one on my lumbar facet. Both sides and everything. And then I do like a pain diary from the time like I left the surgery center to the time I went to bed. And like every half hour I had to write down like my pain on a scale of 1 to 10 stuff. So then I went back to the office and we discussed that and everything, and the next step that I'm doing for my health to get my pain under control is radio frequency. I can't remember the whole term for it, but it's cauterizing my nerves. Sorry, there was like a fly or something. They're cauterizing my nerves with a hot needle, so they're basically like deadening the nerves that are causing me pain in my joints and stuff. So like I just had my first 1 out of 6. I have to have 6 procedures done for that, and so it's every Thursday until November 10th. I had my first one last week on my upper right sacroiliac joints in my back, and I had 6 needle marks, like when I took the bandage off a few days later and stuff. But I was like sedated for it. He said that I would be kind of awake, like in the twilight zone kind of thing, but I don't remember anything about it. And I've been feeling like slightly a little bit better from that, but I'm still like really super sore. So I go for my next procedure tomorrow, actually, at 8:45 in the morning, and they'll be doing the lower right side of my sacroiliac joint, and then I think after that they go to the left side, and then they do like my upper, like lumbar facets and stuff. So I'm really like hoping that that all works out and starts relieving some of my pain, because I don't want to be on like pain medicine and stuff, because like I don't know, I don't want to put a bunch of medicine into my body if I don't have to. Just because I know like it could damage your liver and stuff like later on. I've already had high liver enzyme numbers before, and I don't want to like damage my body any more than it already is. But if this all works out, then it can last for a while. Sometimes it lasts like a month, sometimes it can last like up to a year, he said. So hoping it's a year, and then they'd have to do it again probably, because the nerves like regenerate back and grow back and stuff. So then I'd probably have to get those procedures done again. But the other option, if that's not relieving my pain at all, is to get a pain stimulator, kind of like my gastric stimulator. But it's made by Medtronic, so it's the same company, but I don't know, I don't want to be like a huge like bionic woman or anything. I already have one electronic device in me. I don't want another one. But if I do, then I'm like a walking billboard for Medtronic. But let's see what else. I've been going to the Tampa Surgical Outpatient Facility. I think that's the name of it. I might have said it in the wrong order, but that's where I've been going to get my procedures done, and the nurses there have just been wonderful. They've really made me feel like comfortable and stuff, because like my mom hasn't been able to go with me, and like my dad has been taking me and stuff, which is awesome, but they can't like stay back with me the whole time because it's really like a small area and stuff, and they have like other patients and everything. But like I've been educating all the nurses there about gastroparesis and stuff, and which is really exciting for me because I love talking about it to other people that don't know, because you never know, like, when you tell somebody, they might know somebody that is kind of going through the same thing, and if they're not diagnosed, they could tell them about it, and then they can get diagnosed, and then they can start, like, having a name for it and trying to find the treatment that works best for them. So yeah, I think that's about it for my health. I got a puppy, and her name is Bella. I'm gonna train her to be a pet therapy dog to go take to, like, the hospitals and stuff. I really want to do, like, pediatric hospitals, just because I remember when I'm in the hospital and stuff, I like seeing the pet therapy dogs, and they, like, brighten my day and everything. And, like, I've had my dog for about a month now. She's a Shorkie, so she's a mix between a Shih Tzu and a Yorkie. She's sleeping right now in her cage, otherwise I would show you, but, she'll be 6 months on the 22nd, and she has to be, like, a year old to get tested and evaluated to be an actual pet therapy dog, but I'm hoping that she will be, because I think that would be a really cool thing to do, like a cool ministry to go around and take her to people that are sick and, like, brighten their day, because it's so cute, like, to have a puppy, like, come and see you in the hospital and stuff, and they just make you feel better. I think that's it. Like, I'm rambling now. But, if you ever have, like, questions about gastroparesis, or, like, visceral hyperalgesia, or, like, Raynaud's, or anything like that, or if you just need somebody to talk to, or, like, ask questions, or vent, or anything like that, send me a message, because don't ever think like you're bothering me or anything, because it's totally not that. I love getting messages from people that, like, are just diagnosed or something. Like, I just got a message from YouTube from a mom that has a girl that's 14 years old, and she just got diagnosed with gastroparesis a month ago. So I think it's really important to find other people that are going through the same thing, because it makes you feel so much better when you know that you're not alone in this disease, and, like, there's, you know, that, like, you're not the only one, and that there's other people that are going through the same thing, and they can help you through it and give you advice and just be there for you. So yeah, so if you ever need to talk to somebody about it or something, you can message me at any time. Like, I would love to talk to you guys. So I think that's about it. I have to do schoolwork for college now. I'm not really excited about it, but that's okay. Algebra is not my favorite subject. Oh, and I have to read this book for school. It's called Raising an Emotionally Healthy Child When a Parent is Sick. And if you're, like, a parent that has gastroparesis, or, like, any disease really, I think this is going to be a really, like, good book. And it gives, like, different, like, coping mechanisms, and, like, it does, like, young children, like, through all the way through, like, teenagers and stuff, like, how to talk to them about, like, different things with medical situations and, like, hospital stays, and like, it explains, like, how to explain it to them and stuff. So I think it's cool. I haven't started reading it yet because I'm a slacker, but I kind of skimmed through it, and I'm like, this is a really good book. This would be very helpful and everything. So yeah, I'm rambling. Sorry. I think I'm gonna go now, and I hope everybody's feeling good, and I hope everybody's having a good week, and I will try to make another video soon. Hopefully YouTube lets me upload it this time, because that would be a lot better than skipping, like, so many months in between with my updates and stuff. So thank you for watching, and I'll talk to you later. Bye.